Hello, Tar Heel families, and thank you for joining us with today's Healthy Heals presentation. My name is Sarah Stallman, and I have worked with Campus Health and CAPS for 13 years, and we're really glad to have you all join in the Tar Heel family. I'm going to share my screen, and we are going to get started. So, this presentation is the Healthy Heals presentation, and Healthy Heals is a collaboration between Campus Health, Counseling and Psychological Services, which is lovingly known as CAPS, and Student Wellness. Today, we're going to focus on the services your student can access at Campus Health and CAPS. The seals on this slide indicate that Campus Health is an institutional member of the American College Health Association and is accredited by the Joint Commission, which we have been since 1986. So where can students access services? Campus Health and CAPS are in the same building located at the south entrance of Keenan Football Stadium near Gate 6. It's basically between the football stadium and UNC hospitals, but neither Campus Health or CAPS are affiliated with UNC hospitals. In addition, you have Student Wellness down here in the student, I always forget what SASB stands for, Student Affairs Services Building South. And you have Student Stores Pharmacy, which is on main campus in student stores. Let's see. So our building, Campus Health and CAPS, have a limited number of parking spaces outside for folks who are receiving care at Campus Health or CAPS. In addition, UNC offers a free shuttle service called Point to Point, which can help get your student from wherever they are to our building. As you're likely aware, immunizations are required for students joining the Carolina community. A list of the required vaccines that each student is required to submit is located on the immunization form, or they can also be found on the Campus Health website. The general deadline to submit documentation of immunizations is June 15th. If students are unable to complete the immunization requirements during the summer, they will be able to receive all required immunizations at Campus Health when they arrive in the fall. Please note that per North Carolina state law, if records are not received within 30 days after classes begin, the student will be withdrawn from the university. So make sure you and your student send in those records. And here's how. The link to the immunization form is located on the Students Connect Carolina Student Services page under the General Items to-do list. After the form is printed and completed, a medical provider can either sign the immunization page to verify the immunization dates, or the student can attach a copy of verified immunizations. By verified, we just mean they have to be signed or stamped or in some other way made official. All documents then need to be uploaded to the Connect Carolina to-do list item. We can't accept mailed or faxed records here at Campus Health. If after reviewing records, additional vaccines are required, a new to-do list item will be added to the Students Connect Carolina Student Center page. On the topic of confidentiality, if a student is over 18, that student has to give permission to share their health records. For students under 18, parents and guardians will be contacted about treatment, with the exception of those medical encounters related to the bullets below. Campus Health does not accept blanket authorizations. A student's emergency contact will be notified if a student is in a medical emergency and unable to communicate. If you want to be that emergency contact, make sure the student has put you as it in Connect Carolina. If the university is aware that your student is incapacitated, you will be contacted. And we also encourage you to make sure that the student adds their cell phone number to the Connect Carolina website, because that will update our electronic health records and just make it easier for us to get in touch with them. During the summer, Campus Health and CAPS are open for in-person and telemedicine services Monday through Friday from 8 to 5. We are closed on the weekends, but during the academic year, Campus Health extends our hours for 1 hour during the weekdays until 6 p.m. And Campus Health is also open on weekends from 8 to 5 for same-day or urgent care needs. Both the Campus Health and CAPS phone numbers are answered 24/7. Campus Health provides comprehensive health services, including all the things you see here. Disciplines include internal medicine, pediatrics, family medicine, emergency medicine, sports medicine, orthopedics, psychiatry, and gynecology. Our integrative health program, which is the last service that's listed, we get some questions about what that means. It provides non-pharmaceutical medical health treatment for eligible folks currently being prescribed benzodiazepines, sleep aids, or other controlled substances. So the program uses evidence-based practices to effectively treat the underlying mental health concerns such as insomnia and anxiety while supporting the safe discontinuation of medication use through individualized taper plans. Coming soon, we'll have a student-led emergency medical first responder service, which will reduce on-campus scene response times by as much as 10 minutes. And the UNC Adams School of Dentistry is planning to provide dental services at Campus Health. Our primary care services are offered by board-certified physicians, physician assistants, and nurse practitioners who provide the range of services you'd expect, from general healthcare to management of chronic healthcare conditions, including eating disorders, diabetes, or asthma. They primarily work on an appointment basis, usually offering visits within 2 days of seeking access. There is no charge for clinic visits with primary care providers. There is, however, a $25 charge for appointments that aren't canceled in advance. Our website gives comprehensive information, forms, and links. In addition, we have a web portal which offers secure communication with Campus Health and providers, including the ability to request appointments, review lab results, and see portions of the health record. Campus Health also offers sports medicine and physical therapy, which at UNC has the unique setup of being supported by both the athletic department and the Campus Health fee. This means that your student receives care from the same providers that are caring for our scholarship athletes. This picture is of Remington, a rehabilitative facility dog who works with one of our physical therapists and the UNC baseball team. So your student might get to see Remington if they visit our physical therapy clinic. Campus Health offers inclusive gynecology services and education to people of all gender identities. Our providers include 2 nurse practitioners and 1 physician. Campus Health offers comprehensive pharmacy services in 2 on-campus pharmacies. The one I mentioned in Student Stores called Student Stores Pharmacy, which is located on the top floor, and one in Campus Health in the basement called Campus Health Pharmacy. Both are full service and provide over-the-counter and prescription medications, including controlled substances like ADHD meds. Flu shots are given at both pharmacies without an appointment, and it's very easy to transfer prescriptions to either pharmacy. Just call or stop by the pharmacy of your student's choice. Both pharmacies also offer free and confidential naloxone distribution. You or your student can request a kit and you'll receive one at the window, no questions asked, to keep on hand in case of overdose emergencies. And that program is generously funded by the UNC Parents Council. We sometimes have questions from incoming parents about how to have their students' refrigerated medications delivered to a dorm. We do not accept delivery of these medications at Campus Health. We don't have the room, we can't accept the liability for the meds, and we really don't want to limit patients' access to their medications since we're not open 24/7. But UNC is fortunate that mail services has the ability to store refrigerated medications upon delivery. So students need to notify the Residential Communication Services Manager in housing, and the phone number for that is 919-962-3695. You just let them know before shipping those meds to arrange for special handling, and all of those details are available on the campus housing website. CAPS is open from Monday through Friday from 8 to 5 p.m. Folks in crisis are welcome anytime during those hours. Most needs can be met, however, during initial assessment times, which are basically 9 to noon and 1 to 4, except on Fridays, it starts at 9:30 to make room for a staff meeting. CAPS has a diverse and welcoming staff. They offer a robust lineup of therapeutic groups each semester, individual and couples therapy, initial crisis assessments, psychotropic medication management, and they consult with campus on mental health needs. There is no visit limit at CAPS, but they do provide brief, problem-focused therapy. Most folks who use CAPS resolve their needs after 4 or 5 visits, while some go a few more than that. About a third of patients who come into CAPS for services will need to be referred to the community for more ongoing long-term services, and CAPS has staff to assist with that process. We know that your student coming to campus is a massive transition. The first 6 weeks are the most critical time. As an example, most students who come to CAPS because of homesickness spent many of the first 6 weekends at home, where they were maintaining connections with their old support system and not developing new connections. If you're missing your student, you might be inclined to come to campus and drive them home for the weekend. We want to encourage you to resist that urge, at least for the first 6 weeks. Instead, come to Chapel Hill and have lunch or dinner with your students so they're getting to spend time with you, but remaining in the campus environment. Some strategies to support your student: ask questions to learn how your student is connecting with their new environment. Encourage your student to develop social support networks and good academic habits early. Recommend Campus Health and CAPS to your student as resources. And remember that this is also a transition time for families, so take care of yourself too. Now it's time to talk about the money. So Campus Health is financed solely by the health fee and the revenues generated for charges. We operate on a cost plus overhead and try to keep costs as low as possible. The health fee for 2020 and 2021 is $200 per semester. This is a mandatory fee that all degree-seeking students pay through fees and tuition each term. The charge will appear in Connect Carolina as fee student health. If your student ends up getting UNC-sponsored insurance, that premium will also show up in Connect Carolina as student health insurance. And we'll talk more about insurance in just a minute. So the campus health fee is that mandatory fee. It gives students access to all the services we've discussed already, as well as unlimited visits to primary care and gynecology. In addition, the fee funds public health work, including the recent pandemic response, academic performance protocols, such as course withdrawals and drops, support with finances and insurance questions for referrals outside of campus health, preconception and pregnancy counseling, sexual assault resources, and comprehensive support for students with diabetes. The Campus Health Advisory Board is a group of students who advise us on what's included in the health fee, the services we provide, and help review benefits and premiums with all 3 of our UNC-sponsored insurance plans, which are for students, RAs and TAs, and for postdoctoral fellows. Please note that anyone is welcome to use Campus Health Pharmacy and Student Stores Pharmacy, regardless of whether or not they pay the health fee. So let's dive into insurance. It's required, so students need to either waive out of the student health insurance using proof of creditable coverage or enroll into the student health insurance each semester. If your student waives out, there is a checkbox option for the insurance information they provide to be used to meet the waiver requirement for the entire year, and your student will get an email confirmation each semester that the waiver was approved. The deadline to waive in the fall is September 10th, and spring is January 31st. For folks interested in enrolling in the plan, the UNC-sponsored health insurance plan is equal to the Gold plan on the insurance exchange as part of the Affordable Care Act. Here's a brief overview of the System Health Insurance Plan. It's administered by Blue Cross Blue Shield of North Carolina. We encourage students who are interested in the Student Blue plan to enroll before August, as the plan begins August 1st. The plan's deductible is $0 for services at Campus Health and $500 for other in-network facilities. After the deductible is met, the plan pays 20% of in-network charges with a $4,000 maximum out-of-pocket charge. This slide shows the health insurance plans that are in-network at Campus Health. You can visit the Campus Health website for specific in-network plan details. We are in-network with over 90% of students' health insurance plans, but for those whose insurance plans aren't listed here, visits to Campus Health will be billed as out-of-network. Campus Health does file insurance electronically for any domestic health insurance plans. For international insurance plans without a domestic address, Campus Health can provide documentation to file those claims. Your students should bring their insurance card or a photo of both the front and back of the insurance card to all their appointments. Any balance after insurance is paid is sent to the student's UNC account. Campus Health, CAPS, and Student Wellness are really looking forward to welcoming your student to campus this fall. So we realize that having a video online like this means it's harder for you to ask questions. All of our contact information is listed on this slide. Our phone numbers, again, they're answered 24/7. If you have a question about our services, it's best to call between 8 a.m. and 5 p.m. Monday through Friday. We also have listed here our web portal address, our website to make online appointments, and our social media channels. These spaces are primarily centered around students, but we encourage families to follow us online as well so you can see the messages that we're sending to your students about health and well-being. We welcome your questions. You can reach out to us online or by phone. But overall, thank you for being here today and welcome to the Tar Heel family.